Well, basically, I've always been personally interested in anti-aging and in beauty. I used to be in the modeling business ages ago when I was about 18, 19 in the States. And of being in that industry, I was always self-conscious about beauty and sort of paranoid about aging. So very early on, I've done quite a bit of research, and I came up with a philosophy, which I still abide by, that I believe in preventing the aging versus waiting till everything sort of falls apart to fix it and then undergo extreme surgical procedures. So early on I started with proper skincare, with knowing the difference between cosmetic and cosmeceutical skincare. And I've also started having facials, chemical peels, and also even Botox early on, all falling under the realm of non-invasive or minimally invasive procedures, which were meant to sort of slow down the aging process so that I can look as good as I can for as long as I can. And I still believe in that theory, and I share that with all of our patients as well. Basically, lasers and facials and anything that's not considered going under the knife is considered non-invasive or minimally invasive procedure. For people that are really afraid, because all of us have heard so many stories about surgery and all the things that can go wrong, so many people share this apprehension. Normally when we do have patients like that, we tell them to start off easy. Usually our goal is to educate the patients about all the anti-aging, minimally invasive, non-invasive and surgical methods that are available. And our goal is to let the patients make an informed, educated decision. So a lot of the times we share information, we send the patients out there to sort of do their own research, and once they're comfortable, they come back to us knowing what to expect. But when they do have apprehensions, we let them start off with something minor, such as a good medical facial. So once they're more comfortable and they're actually seeing the results and the improvements in their skin, and we have their trust, then we sort of slowly take them further into and introduce them to lasers and further down to whatever the condition they have and the treatment that we can offer them for that. We have a lot more males, surprisingly. We have an increased numbers in males as well, wanting to take care of their skins. Of course, males don't go for very obvious treatments. Females, I'd say right now there is an increase in younger population. I'd say maybe 23 onwards are starting. Now keep in mind, look, we have teenagers that suffer from acne, so that's something that they come for. A lot of the girls, younger age groups, they come for basic treatments such as laser hair removal. And then we have the sort of cream of the crop type patients that we have a lot of are sort of their mid-20s, late 20s, wanting to sort of preserve that the look that they have for as long as they can have. So most popular, we have a lot of those. They're super popular, the fillers, the obvious ones. But then right now more and more patients are aware of the lasers, because the whole sort of technological advances have improved and there's a lot of information available. So currently the gold standard for anti-aging, as was confirmed by the American Academy of Cosmetic Surgery, is fractional resurfacing, which is the laser that's meant to rebuild tissue. So it's for lines and wrinkles, it's for pigmentation, it's for tightening, it's for blotchiness, it's for open pores, it's for acne scars. So it pretty much treats and reverses completely any skin condition that you may have. And it is, so if you start early on, like once a year, then this is the best way to preserve and maintain your look. If someone is a bit older, then we would need to, because each time we're building 20 to 30% of new tissue. So if someone is older and they have many skin conditions, then we would say, look, you would need 5 sessions to get complete resurfaced skin, wrinkle-free, pigmentation-free, sun damage-free, tighter skin. And then once you achieve that, then you go for monthly or bi-monthly treatments just to maintain the results. So it all again depends on the age group, but it's become quite popular because I think, and it also goes by word of mouth. People are now much more open to talking about what they've had done freely with their friends, and of course when they're happy and they look good but still look like themselves, just fresher version, then they share that, and that's how it all sort of builds up from there.